you so much, Jenny, and everyone, and I'm so glad to be here. I will be presenting initially about public health and the start of our Healthy Chicago 2025 plan, and then Ginny Turner will be talking about sort of where we're going from there, sort of what came out of the plan, and how we can all move forward together. And you'll see, I guess I do this a lot when I talk about it, and we do it as we do it. It's working in partnership. And with this plan is not just for the health department and not just for the city of Chicago government, but for all of us. And because that's how, when we look at public health, we see that is all of us doing our work to improve the health and quality of life for people who live in Chicago. So I guess I can control this and go forward. So first of all, again, thank you so much. I did want to just sort of present some like basic things about public health. And as you'll notice, actually all of these, when I was looking, all of these sort of definitions that the public health system uses are a little old, but they point to what we've known for a long time. The World Health Organization focusing on health is just not whether you're sick or not sick, but it's not merely the absence of disease and infirmity, but it's a state of complete physical, mental, and social well-being. I really also like this statement from the Center for African American Health Status Report, that health is the behavioral, cultural, economic, educational, physical, and spiritual state in which individuals have the ability to enjoy life and contributed positively to their family, community, and society. And as Ginny and everyone was talking about, this really describes a lot of the work that you're doing in the communities and that we're all trying to do together. And so that's generally how we think of health. And then when we think about what public health is what we as a society do collectively to share the conditions that people can be healthy. So it's important to remember when we think about it, the factors that influence health. You can see healthcare here is only identified of only having 20% of what contributes to a person's health and a community's health is the healthcare. And it's very important. We're not saying it's not. Also, health behaviors are very important. But if you take a look at the physical environment and socioeconomic factors, they also make up a huge chunk. I mean, these two are the 50% of a person in a community's health. So it's important to focus on that. And that's a lot of what public health does in collaboration with a number of different organizations. I did want to just present some guiding frameworks when we talk about public health. This one on the left is the 10 essential public health services. And actually just recently this past year, they updated it and you can see a lot more focus and acknowledgement for equity, health equity and racial equity, and really aligning, taking a look at what we do as a public health department and in collaboration with all of our partners. We take a look at innovations. We look at enabling equitable access. These are kind of language and approach that public health is taking now. And it's very exciting within the city of Chicago and throughout the United States to really having racial equity and racism being identified as the underlying cause of a lot of the health disparities that are going on, the health inequities. This other model here, the WHO, the World Health Organization's framework for social determinants of health, and you might be able to see yourself within this. Just move this over a little bit here. It's blocking, there we go. The little pictures were blocking my view of this slide, but as you can see, a lot of this goes to, we took a look at the structural determinants of health. We look at like education and how someone's occupation and their income contributes to their health and their socioeconomic position. We take a look at, the behaviors and the psychosocial factors that all contribute to and have an impact on equity and health and well-being. And that it all goes back to like, how can we all work together and address governance, address policies, public policies and social policies and cultural and society values to really make a difference and improve the health of our communities. So just sort of overall, and hopefully I would imagine most of you see yourself within these models of the work that you're doing as part of public health system. So just to sort of go over again too, obviously I'm from the city of Chicago, Department of Public Health, so I'm in governmental public health. And there are, as you know, there's these governmental agencies that oversee this very important work. And obviously a lot more people know what public health is now with COVID-19. Um, Federally, you can, there's a lot of different, everyone has heard of the Centers for Disease Control and Prevention. There's also the Centers for Medicare and Medicaid Services, making sure that health, uh, people with low incomes and also older people have access to health services. So I guess when we think about, again, with talking about public health, thinking really broadly. So these are some of the basic ones. We also talk about the state. There's the Illinois Department of Public Health, and then we actually have 97 local health departments throughout the state. And then in Cook County, it can get a little confusing. With CDPH, we are our jurisdiction, and we are responsible for the city of Chicago, the Cook County Department of Public Health, and with part of the Cook County Health and Hospital Systems, is responsible for suburban Cook County. And then there are some smaller departments, health departments within suburban Cook County. But all of this works together to really address, sort of think about what public health is. And then there's even more. I don't know how to do this with if our chat in here, but we could also think beyond this, when thinking about public health. So like the FDA is a part of the public health system at a federal level, dealing with food. We deal a lot with food insecurity and nutrition. So that actually is part of the larger public health system. We think of the EPA. So with environmental risks and ensuring the health of people for a safe environment, addressing climate change. Also think of OSHA and NIOSH, the organizations that address workforce and health issues, safety issues. We can also think of the Department of Labor, a lot of the things with working a thrivable wage, other workforce development efforts. So really thinking broadly. Again, the ones I have listed are the ones that people usually think of, but when we talk about public health as being a very broad system, and organizations, governmental organizations, and also community organizations that contribute to health and community well-being. So just to talk about the CDPH for a little bit, we are the health department for the city of Chicago and serve the 2.7 million people living in the city. We are going to be talking about Healthy Chicago 2025, and our work is guided by this health improvement plan. And you can see our mission here is to promote and improve health by engaging everyone in this work, communities, our partners, and helping to establish and implement policies and services that prioritize communities with the greatest need. So again, just not to pull the point too much, but when we talk about the local public health system, this is sort of a conglomerate, sort of a messy web. And I think that really is what public health system is. Now you can see the health department is in the middle and has sort of the largest circle here. That is because it is our ultimate responsibility, but hopefully you can find yourself as part of this. We have a lot of education and workforce development is connected to all these community organizations, and our work that's happening as it connected to community health workers. Arts and culture is a part of the local public health system, and the way that they engage people and help people express themselves and address health and safety within their community. Civic groups, I'm just sort of the justice system, academia, thank you very much, UIC, School of Public Health, hospitals, obviously, but parks and everything, we go from there. So I guess just what I wanted to highlight with this is that we really all feel a part of the public health system. And like I said, as we talk about this plan, is really for all of us, not just for CDPH, but for all of us to work together. So just real quickly, we followed this framework to do this community health improvement plan. We do this every 5 years as part of being accredited, and this model, and as part of it, we do gather a lot of data and engage a lot of partners in this work. And so what's exciting about this one that we actually released in September of this past year, And the focus really, as you can see, is really here on communities. We want all communities to have power, to be free from oppression, and to have equitable access to resources, environments, and opportunities, again, that promote optimal health and well-being. And obviously all the work that you're doing and UIC is doing is moving us towards that, that vision and that goal, I guess that vision. What I wanted to point out here too is very exciting. We worked with a number of different people to develop that vision before we got started. And it really maps on, if anyone's familiar with the Bay Area Regional Health Inequities Initiative. And here you can see I've mapped our vision right on top, but it really addresses the focus of where public health is going. Like, again, the optimal health and well-being, focus on mortality. I mean, that is our ultimate measure, and also disease, injury, and health behaviors. But really where a lot of the work that we're doing now is on impacting living conditions, talking about institutional and social inequities. I find it very interesting. Right now, we are focusing on reacting a little bit, reacting, and as much as possible, and that is a part of public health, but also preparing for that and setting up prevention. Looking at prevention is to have as much focus as the reaction part of it. We do have an emergency preparedness unit that did develop plans, and obviously everything like that needs to be improved or adjusted to the actual situations, but a lot of public health is looking at those underlying conditions and moving this forward. So again, if you can, hopefully, I would imagine you see yourself a lot in here within the living conditions, and knowing that your work and all of our work together is really addressing sort of the most upstream root causes of mortality, and the mortality gap is this really focusing on these institutional inequities and racism that is really impacting our community. So just real quickly, I'm not sure where I am with time. To get all this data and to do the assessment and develop the plan, we worked with, I guess, thousands of people, I guess we could go for. We did a lot of surveys and focus groups to collect, probably similar to what UIC or what you've been involved with, and maybe some of you were able to involved in some of those focus groups or take those surveys to find out what was going on within the communities, within your communities, what were some of the strengths, what were some of the things that you wanted to improve on and needed improving. We also reviewed different community plans, and I'll talk about that in a moment, and held a number of community meetings to hear directly from local organizations about what was going on. We take a look at the system. Jenny was talking about the system, really to understand, we really need to improve how the system is working. Again, this web that I showed you, to strengthen that work as we look towards improving our response and our ability to promote equity within Chicago and the communities. And then also compiled thousands of indicators. I don't know if you have gone onto the Healthy Chicago data compendium yet, but that is, if you haven't, you'd want to. There's a lot of data there, and through many different sources to really understand community conditions and what's working and where are the gaps. This is just an example.
Sherry, just for a time check, you're coming on 14 minutes.
Oh, okay. I did go quickly. I will just go quickly here then. This was some of the data. You've probably seen this before, the life expectancy gap, which is really moving us forward in here. And this is like one of the main things that we're going to be monitoring and that we recognize as unjust. And really, as I talked about, those root causes of racism and inequities, institutional and structural inequities, is the most that impacts and is the reason for this huge life expectancy gap between Black and white Chicagoans. Again, we work very closely with the community on this. I will send these slides out. Also important, we recognize all the work that's happening within your organizations and within the communities, and we integrated these plans into all of the data that we collected. So when we come up with the resources or came up with the themes and priorities, they were reflected a lot of the priorities that were mentioned in these plans. So just real quickly, from all of these four themes emerged, talking about transforming policies and processes to foster anti-racism and multicultural systems. Really, the importance of community capacity and youth leadership. I talked about systems, systems of care, improving that for populations most affected by inequities, and being asset-based and focusing on the health and vibrancy of our neighborhoods. We identified 6 guiding principles that we are going to move as we move our strategies, move our work forward. These are what we are going to be focusing on and integrating into all of our work and our partners and everyone working that through. Again, hopefully some of you were involved. I don't know if any were involved in some of this. We held work groups. You can see the types of the work groups we held. Over 600 people had volunteered to be on these work groups to help us identify the strategies for each of these different areas. And from that, I will go into Ginny's work or discussion of these priorities.
Thank you so much, Sherry. Thank you. That's the slide. So I'm going to share a little bit about the actual Healthy Chicago 2025 report and our plan for change. What you'll be seeing is some snapshots directly from the document. So please don't be concerned if they are not clear enough for you to read all of the details. We will have a link to the report for you. But what this slide is just basically to show that for those overarching themes, to close that racial life expectancy gap, and if you would have noticed that there was the huge gap between Black and white Chicagoans, but was really Black and all other Chicagoans, and there was decrease in our Asian and Latinx life expectancy, and the only group that was showing a slight increase were white Chicagoans. So for those 4 themes, we worked on who is it that we should be, what areas, priority areas should we be focusing on to do this work? Who is actually truly experiencing those inequities that we want to start focusing on? This is not everybody, but where we want to put our focus on to begin with, and what an ideal state. Though we do this health improvement plan every 5 years, 5 years is not always enough time to really move the needle truly forward. So we're saying, our true goal as we do a plan every 5 years is going to the point that within one generation, all Chicagoans are living that Healthy Chicago 2025 vision. Next slide, please. So when you look in the document, you'll see for each of those areas, we go a little bit deeper with the plan for change. So this is an example for the food access, where we're saying within one generation, all Chicagoans have enough nutritious food and local food businesses actually thrive. And how would we do that? And there's some steps to talk about exactly publishing a food environment map, looking at food policies for food justice issues, and using that public health data to kind of strengthen those policies and plans and practices. Next slide. So for each of those areas, here's an example of housing. So once again, we have a specific plan for change. I know that each of the breakout groups are going to be focusing on some of these areas. Do not feel that you need to figure out where you fit in those plans for change, but just where you fit in these particular areas. And it might not be areas that are obvious, but like under housing, train developers to co-create health action plans with residents. So no matter what group that you're working with, you could have a place at that table with those developers who are building in your neighborhoods to ensure that they're taking the considerations they need for you to have a healthy neighborhood to work in and to live in. We've also identified equity measures and how we would start off determining whether or not we're moving that needle forward. And once again, what that ideal state is. Next, please. I'm going to go through the next ones rather quickly. So there's a food access. I talked about that one in that first example. There's an environmental one, refining our air quality and health index, having an environmental equity working group. We want to see the reduced exposure to pollution and increase those buffers between the sensitive and residential in industrial areas. Next, please. We have public safety, reduced exposure to violence, increased perceptions of safety, police, and accountability. Once again, all of these plans for changes came out of those work groups and strategy sessions that we had with our residents and community partners. Just trying to decide like where is it that we want to start this work. It's not the end all, and this work, if you will notice, is not necessarily work that CDPH is lead on. CDPH may be supporting some existing tables that this work is happening. Neighborhood planning and development, ensuring that health equity measures and strategies are in. This is something that we're looking around, like how we do this across our city sister agencies. We're doing something called Health in All Policies, where we are plan to train city personnel as well as our community partners on how to conduct health and race equity impact assessments when it comes to developing policies and practices. Next, please. There's Health and Human Services, and then there's the public health systems organizations, of which, once again, you guys are really part of. Strengthening what would be considered one generation, um, 25 to 30 years. So think about like from one generation to the next to start having kids. Um, here's something, that we really want to see an increase in the diversity of the workforce, and not just the workforce, but the leadership, the people who are making the decision, is their diversity at that level, and increasing the community capacity pieces of it. One of the things that we're trying to do later this year is have, capacity building seed grants to some of the smaller and mid-sized Black and Latinx run community-based organizations and develop a learning collaborative. We like to pilot that if all goes well in the midst of COVID, but we like to pilot that later this year where we're actually giving money, not to do programming, but giving money for the organizations to build themselves and build their leadership and then build their capacity to do the good in their communities. Next, please. So one of the things that we are looking at is, well, how do we know that we are actually moving this needle forward? So we've talked about developing a racial equity dashboard. And there's 4 indicators that we're using as a starting point for this discussion. And we will build additional indicators along with our community partners, community data scientists, as far as what are the true indicators that they feel. I do not have a definition on what a medium-sized CBO is. That's still to be worked out. So what the 4 indicators are: life expectancy, the percentage of adults who actually report good health, the percentage of adults that are living in high economic hardship, meaning that basically the majority of their income, their income doesn't really help them, their socioeconomic status. That's the best way to put that. And then these are data points that we are already collecting. So this percentage of adults who actually say that they have psychological distress and who have an unmet behavioral health need. So these are just saying, for a starting point, what is it that we want to see improvement in, to know that the work that we're doing around Healthy Chicago 2025 is going forward. This is not the end all. It's just the beginning indicators, and we're working with the Mayor's Office of Racial Equity and Social Justice. We're working with our community partners to develop what are the other indicators we want to see added to this, and then create, hopefully, a citywide, all agency-wide racial equity dashboard to be utilized in the future. Okay, next, please. So the change process. Sherry talked about the 6 guiding principles. We have been going out and sharing this with our sister agency, internally within CDPH. Some of our academic and community partners are saying, even though our implementation phase is still in development and has been delayed because of our need to do the COVID response, people can still today look at those guiding principles and figure out where this work fits in their day-to-day activities and how they can promote these principles in their day-to-day activities. As far as the implementation planning that we're developing this year, we basically want to make sure that we're going to be working with our communities to collect and analyze the data, support people and those communities to co-own and co-develop those solutions. And we want this to be partnered across the various sectors. So think of financial institutions, think of funders, think of businesses. They should all be at the table with our community partners, along with policy people, government people, to develop those true deep change policies and practices that are really going to impact those social determinants of health and those health inequities. We want to advance those changes at all levels and then evaluate whether or not we're being successful in closing that racial life expectancy gap. Next. Okay, so questions are going in the chat. I guess want to just highlight a couple of things and connect to some of the conversations earlier. You know, we talked about enhancing the ability to connect at an organizational level. You know, one of the reasons why we're here to come together and fight those health inequities. You know, we're building up the community capacity to do collective impact along with your government partners and other cross-sector partners to really see that system level change. When I was looking at those survey results of what you guys were looking for, you know, health was, I think, was fourth on the list, or health messaging. But honestly, as you have seen from this presentation, there's so many things that impact health outcomes that what you're doing in your day-to-day work as a health partner really impacts this. And then, you know, think of it this way. One of my probably professors told the story of, you know, a bunch of people from a village were down at this, you know, spot on this river that ran at the edge of town. And they noticed all these babies were floating by in the river. So they started pulling all these babies out the river. And they're just like, okay, babies just coming down and they just got to keep killing them out the river. And one person who was helping stopped pulling babies out the river and started running away. And they're like, where are you going? He's like, I need to go find out why these babies are coming in the river in the first place. So think of that as like the public health. You know, yes, we have the stuff downstream. We want to change behaviors. We want people to eat healthy. You know, we want people to, you know, have better jobs, but we also need to look at why people don't have access to good jobs and good foods and good education in the first place, and go upstream and work on that as well. So with that, I'll check and see if there's any other questions in chat. There is Sherry's on my email. Yes, this presentation will definitely be available. So any other questions, please let us know.
Yes, so any other questions that folks want to pop into the chat? I think we have time for one more. So here's a question. So what are some first steps that an organization can take to identify themselves as wanting to address some of the issues brought up in your presentation?
I would say looking at those guiding principles. So Sherry, I don't know if you want to slide back to that. That if as an organization, if you are taking the steps to take a look and say, are you identifying and addressing your processes and strategies to ensure that they're anti-racist? Are you uplifting the community strengths and helping them tell their stories? Are you really considering when you develop your solutions who not just is benefiting from, but who is might be burdened? Are you being trauma informed? Are you helping promote that community well? And how are you making sure that you're partnering with the community? And as a CBO, it's easy to say, yes, we're partnering with community, but you know, we, and I'm saying we, meaning really me, have a tendency to continually go to the same people over and over again. Who is it that's not at the table? Asking that question. Who is it that you have not connected with that might have a different input and insight? So that is the first part of it. The part as far as like for the CDPH and the Healthy Chicago 2025 is just keep your ears open. I'm sure through this group you will hear when we actually start doing some more actual implementation stuff. It is just in flux right now because of COVID. We would have had implementation probably kicked off last fall in a non-COVID world. So, and I think our RFP for the seed grants may be released next. No, that's a lie. Sorry. Our RFP for a coordinating agency to help us run the seed grant program, I think is going to be released next week. And then in partnership with that CDO, we will develop a program for the summer and fall for those small, mid-size, which have yet to be determined what that really means, Black and Latinx organizations.